Alright, this is Devon again. This video will be my video on nasal gastric tube insertion and removal. Alright, so before going in to see the patient, I am going to check the chart to see if the patient has had any trauma or surgeries on their nasal passageways, or any area that would affect tube insertion. Okay, once I determine that, according to the chart, there is nothing stopping us from inserting the tube, patient hasn't had any surgeries or trauma, then I would enter the patient's room. So, knock, knock. Alright, so I would go in, I would introduce myself. Hi, I'm Devon, I'll be your senior nurse today. The doctor has ordered a nasal gastric tube to be inserted. Are you okay with that? Do you have any questions? According to your chart, I did not see any recent surgeries or trauma to your nasal passage areas. Have you had any surgeries? The patient will respond no, so that we can proceed. So then I would identify the patient. All right, Miss Bear, can you tell me your full name and date of birth? All right, then I would adjust the bed. I would bring the height of the bed up to my waist, and I would put the head of the bed in the high Fowler's position for the patient's NG tube insertion. All right, then I'm gonna gather all my goods. I got a stethoscope, the NG tube with a 60 ml syringe attached, a pen light, some napkins or pretend napkins, 2 cups. I would have tape, and one would be split in half partially, but I don't have tape with me. And then I have a tongue depressor to check the gag reflex. All right, so then I would hand the patient a cup of water and let her or him know that I'll need them to take a few sips of water while we do the procedure, while we perform the procedure of inserting the tube. Also, I'm going to have Kleenex close to the patient in case there is some eye watering or, they need to clean up during the procedure. I would also ask the patient about any vomiting or nausea, anything like that they might be experiencing. But we're going to assume that everything is good and we can proceed with the insertion of the tube. So prior to inserting the tube, we have to measure. So we're going to measure from the patient's nose to ear, and then from the ear down to the xiphoid process. And then we will mark the tube. So we will measure from the nose, tip of the nose, to the ear, and then from the ear to the xiphoid process. And this is where we will mark the tube, and that would be, we would insert the tube up until this point. All right, so once it's marked, we have our syringe attached. I have already performed hand hygiene and donned gloves. So there is no need for sterile gloves in this case because the nasal passageway down to the stomach isn't considered a sterile area. Okay, so I got my lubricant here, gave my patient a cup of water to hold, and sip, I'm going to lubricate my tube. Let's pretend this is my lubricant. All right. And then we're going to start the insertion of the tube. So we're going to insert down and back. Okay, so we're inserting slowly, asking the patient if they're okay, having the patient take a sip so I can keep going, because we need them to swallow so that we can open the nasal passageways. What? Babe, hold on. Alright, so the tube seems like it might be in place. I'm going to ask the patient to open their mouth. I'm going to use my pen light. Oh my gosh, let's go back. Okay, so we got to do a couple other things before we insert the tube. So we didn't insert it yet, so now we're going to insert it. We have to look at the nose, the nares, make sure there's no septum deviation, there's no redness, swelling, and make sure the nares are, the patency is good bilaterally. So then also, after doing that, we would check the gag reflex, so this tongue depressor, make sure to see how the patient is with swallowing. So we'd stick this back and gently touch the uvula to see if the patient will, cough or have a reflex. So we're checking the gag reflex. All right. So after that, we can insert our tube. We've already measured, so we're inserting up and back, and then once we get in, we're gonna ask the patient to touch their head to their chin to their chest, so that we can, it'll help guide our tube in the right direction. So the patient has her head to her chest. We're guiding the tube slowly up into our marked area, and the patient's also taking small sips as we're doing so. So now the tube is in the stomach. We would never let go of the tube, so we'd be holding the tube to the marked area, and then we would take our syringe and we would pull back on the syringe, and that's going to give us some of the aspartate, some of the stomach content. Okay. We would also tape the tube to the nose, securing it to offer support for the nares, so we don't cause any obstructions or anything while it's in there. And then we will also use an anchor device, whatever is provided by the facility, or in the video I think it says something about a rubber band, and you tie it a certain way and you pin it to the clothing. So we would do that to secure the tube and all that good stuff. Wrap our tape, make sure it's secured up here. And we would continuously assess the patient's comfort and pain. So asking them if they're okay, if they need us to stop for any reason. Also, we would auscultate the lungs and the bowel sounds prior to the insertion and after the insertion of the tube. Just listening for normal breath sounds and normal bowel sounds to make sure everything still sounds good. Then we would take our stomach contents and put it into a cup, an empty cup, and we would test for pH to make sure it is actually in the stomach. We will not use the tube until the patient has had an x-ray to verify that the tube is in the stomach, in addition to the verification of the pH. As long as it turns like orange between 1, I think, and 4, or 1 and 5, it's considered to be a pH of the stomach. So as we end, we are going to take the patient's bed to the lowest position. We will not elevate the head of the bed more than 30 degrees. Reassess the patient, make sure they're comfortable. If we pull the curtain to give them privacy, then we would undo that if it's okay with them. Give the patient a call light. Make sure everything's okay, patient feels okay. And then we will exit the room. Well, do hand hygiene, take off your gloves, do hand hygiene, and exit the room. On removal of the tube, we would undo the tape, undo the clamp on however it's adhered to the shirt or the clothing, the gown. We would take that off. We would ask the patient to...
How about you, Lion? Can you make any sense of this? Oh, you're no help either.
Exhale.
Store this thing in your name.
I'll let them know that... Actually, before all that, we would have to let them know that we have a doctor's order to remove it. Ask them if it's okay, if we can move forward with that process. Patient agrees. Then we would detach the tape and the clip of the shirt. Assess patient comfort and pain, and then let them know that we're removing it. As we are talking to them about the doctor's order and all that, we're practicing hand hygiene, and we're donning gloves. We slowly remove the tube from the patient's nose and disposing of it properly according to facility policies. We're assessing for pain, discomfort, adjusting the bed to the lowest position, giving the patient their call lights, taking off gloves, hand hygiene, asking the patient if they need anything else. Make sure they have their call lights. And I'm not sure. I think it would be a good idea to probably listen to their lungs and maybe vowel sounds again before ending or before leaving the room after removing the tube. But it's really hard to remember everything on a bear. But hopefully I got everything. And this is it.